You've got mental health, you've got the paramedic, you've got pharmacists, you've got care coordinators, other care coordinators, and you've got social prescribers. So we would all refer to each other. So you've got that group of people that are there in the offices with you that you can speak to. That's the teamwork for it. You speak to each other and then you can go forward. If you need any help with anything, then you go forward with their thoughts, etc. So it is just about working as a team, giving the best of what you can give.
Part of our role is to take the pressure off GPs, but actually what we are finding is we are supporting patients with things that GPs may not be actually equipped to support them with or have the knowledge to support patients with. We've had patients come to us who are feeling low in mood and don't see anyone, just lonely and fed up, and actually once you find and get them into something they really enjoy, like a group, you find the knock-on effect of that is brilliant. As a team, we're able to help so many patients.
I have almost on a daily basis interactions with my colleagues at work, so it's really good that if I'm stuck on something or I'm sure, I can go to them for their expert help. I say, and it works vice versa. There's an example of a vulnerable elderly patient. I had an appointment with this patient to discuss him starting a blood thinner for his heart. One of my colleagues, who's a frailty nurse, went to see him at home. His living conditions aren't particularly good, and I was able to sort of talk to the frailty nurse and discuss with the GP the suitability for a blood thinner, and we agreed probably it wasn't in his best interest. Otherwise we may have still prescribed him something which is not appropriate, and we wouldn't have known about his living conditions if he hadn't had his home visit. So actually it's a really good example of where teamwork has benefited the patient.
Each morning a set number of patients will appear on the triage service, and then I will contact each one, see whether they need to be managed or whether they can be managed over the phone or whether they need to be seen face to face, in which case I will see them face to face throughout the course of the clinic, and then I will organise assessment, testing, interpretation of results and treatment as and when required. So I see a huge variety of things, so they can deal with anything from coughs and colds, sore throats, stomach pains, sort of issues with maternity elements, sometimes medication requests, anything really that is more acute than more long term is something that I can deal with. So it enables patients to have almost same day access to the surgery. They can see myself or the A&P sort of same day for most things, and we can deal with most things, to be fair.
I mean, we haven't had paramedics historically. It's a relatively new thing for our surgery, but it's been a huge improvement in terms of teamwork, because we can spread the workload out, and it does free us up to see the more complex patients, having members of the team like the advanced nurse practitioners and the paramedics there. I mean, we all work very much as a team. None of us can do our job without the other ones. So, for example, if one of us is the duty doctor for the day, we would be supervising our nurse practitioner and our paramedics. So any complex patients who they need to ask advice about, we would be going in, perhaps reviewing that patient with them, or at least just discussing it, and prescribing for the team members who aren't prescribers themselves. We would all keep an overview over what's going on in the practice during the day as the duty doctor, and it's a lot of it's about coordination now, and making sure that all the patients are safe and that the various staff members feel happy and confident in their diagnoses and management plans.